Hello. I've started my IVF treatment a while ago. Like you, I had various questions at the beginning, but with the appropriate support group around me, soon everything was clear. My doctor prescribed me ARVEKAP. I'm going to show you all the steps for preparing your dose and applying it correctly. You'll see, it's not that difficult at all. A few words about ARVEKAP. It is used either to inhibit ovulation until the follicles mature, or for the final maturation of the eggs before ovulation. It is sold in a box which includes 7 sets. Each box contains 7 vials of powder and 7 vials of solvent. You will need 2.5 ml syringe for mixing the medication and a small grey needle for the subcutaneous injection. ARVEKAP is kept at room temperature, protected from light exposure. I keep them in my drawer. If your doctor recommends ARVEKAP on a daily basis, then the dose should be done at the same time every day. Pick a fixed time that suits you, in the afternoon between 5 and 8 PM. If your doctor recommends one single dose, then you should inject strictly on the day and at the time indicated to you. Before we start, we wash our hands thoroughly with soap and water. Let's check that we have everything we need in hand for the daily dose of ARVEKAP. 1 vial of powder, 1 vial of solvent, a 2.5 ml syringe with a removable needle, a small needle for subcutaneous use, cotton, alcohol. Now let's prepare today's dose. Remove the cap from the vial with the powder. Gently tap the solvent vial on top to remove any liquid remaining on the tip. Check for a special mark on the ampoule. Break it at this point by applying constant pressure. The movement is like trying to fold the tip. Now insert the needle on the syringe into the vial with the solvent. Pull the plunger to draw all the liquid. Pierce with the needle the centre of the vial with the powder and slowly inject the liquid, gently by pushing the plunger off the syringe until it's completely empty. With gentle rotating movements, mix until the solution is clear and free of particles. Try not to shake it hard to avoid creating bubbles in the vial. Turn the vial upside down and draw the liquid by slowly and carefully pulling the plunger on the syringe. For easier suction, lower the tip of the needle into the gap in the inner side of the rubber stopper. Ensure that all liquid is drawn and remove the needle from the vial. If your doctor advises you to dilate 2 powders with 1 liquid, then inject this liquid slowly into the second vial of the powder. When you complete the mixing, carefully insert the protective cap back onto the needle, remove it and discard it. Now insert the small needle into the syringe and remove its protective cap. Hold the syringe with the needle pointing upwards. Tap lightly to help any air bubbles rise to the top. Then gently push the plunger to remove them. If you need to put the syringe down, make sure you put the protective cap back on first. And now onto the injection. It is not as hard as it seems. The injections are done in the abdominal area, in the smile below the navel, 2 to 3 fingers right, left or down, at a different spot each time. Pick the spot and clean it with some cotton and alcohol. Lift the skin in the area and insert the needle with a steady and firm motion, vertically or diagonally. Don't worry, it is very thin. Push the plunger gently and continuously without stopping, until it stops coming down. When the syringe is empty, remove the needle. That's it. Press gently with the cotton on the injected area and massage lightly for 2 seconds. Close the needle with the outer cap you have held aside. Used syringes should be disposed of in a special bio-waste bin. If you do not have access to one, keep them and ask Embryolab to be discarded safely through their bio-waste management system. See? It wasn't that hard. Here you will find more useful tips. For any additional questions, you can always contact Embryolab.